All right, so we talked about cold calls. Let's talk about warm calls. Okay, warm calling refers to calling a prospect with whom you've had some prior connection between yourself and the prospect. That's why it's always good to make that initial cold call, right? These are your follow-up calls now. The warm-up calls define. Now, if you guys are hearing the thunders out there, or I guess we're having a thunderstorm right now. So, I apologize if you start hearing some rumbling in the background. Okay. And, my office window is my office is right next to the window. Okay. So warm calls, right? Let's define warm calls. This could be coming from industry events, previous cold calls, referrals, appointments, internet leads, response to an ad. So industry events, are you out there networking, meeting people that you should be meeting, right? Previous cold calls, these are your follow-ups, right? Referrals, did another doctor refer a person to you to look up? When you ask for somebody, anytime that you meet a new doctor, a new potential referral source, before you even have the meeting get started, you literally ask this question. You know what, doctor, before we actually start talking, let me ask you this. The information I'm going to share with you is very important and it's amazing stuff. Would you know any other person that would possibly benefit from the services that we're offering? Other doctors that you can refer us to? That's called the referral close, meaning I'm asking for a referral even before I started presentation. And then I will ask that same question in the end of my presentation as well. So you always want to be able to make sure you get referrals, okay? You want to be able to make sure you follow up with referrals. Appointments, after you actually had that initial appointment when you met with someone, okay? You want to be able to follow it up with a phone call, right? You already warmed things up already, okay? You already dropped off that first donut set of yours, okay? Internet leads. We talked about, remember I told you guys that, you have to have cold calling stuff, and you also have to have internet marketing as well. So you need to be able to, or your social media. So when you are having this, did somebody actually show interest by sending you information or a text message or an email saying that, you know what, I want to be able to get more information about your company. Can you please send it to me? Okay. And then also response to an ad. Are you actually putting advertising out there on local senior papers and local, newspapers out there, whatever you're doing, or Craigslist ads, for example. You need to be able to make sure you market your company in every single way that you can. So there could also what we call a potential for a warm connection that may turn to cold. So let me tell you about this information, about an incident that can happen to you guys. So you want to beware. Okay, I want you to beware of someone giving you a hot lead. Sometimes you may call and then they don't know much about you. So be prepared to handle a warm call as a cold call. Just because somebody gave you a referral, that doesn't mean that they know who you are. So when somebody gives me a referral, I most of the time ask a doctor, can you do me a favor? Can you give them a call right now and tell them that I'm going to be meeting with them, or I'm going to be giving them a call sometime soon? Or, doctor, I was hoping, can I go ahead and, have you email them right now or send them a text message, right? Warm them up for me first. Because the last thing you want is calling them and say, hi, Dr. Patel, this is Michael with ABC Home Health Agency. I was just giving you a call because I got referred to by Dr. Smith. And then Dr. Patel says, Dr. Smith didn't tell me about you, right? So when that happens, do you know how to go past that problem? Or are you going to start stuttering if that ever happens?